The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. A history and physical is the starting point of the patient's story. This is the time when our physician-patient relationship begins. The patient will explain their past medical history and mention their medications. I will then perform a thorough exam. This is where I look, listen, and feel. I look at the patient while they're speaking to me, I listen to what they're saying, and I feel them both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. If you wait, it's too late. To my military family, I got your six. To my Masonic brothers, the light is bright. Before I discuss today's topic, I'd like to follow up from last week's presentation. A boxer who suffered head trauma from a more experienced boxer during a sparring session a year ago was referred to me by their new coach. I was informed that their symptoms were progressing. The symptoms were getting worse. Before the boxer entered my office, I placed a call to a local diagnostic center and presented this case to the radiologist. Instead of ordering a CT of the brain, the radiologist suggested I order an MRI with head trauma protocols. So this is something that I learned. The boxer entered my office and I examined the patient. The physical and neurological exam were normal and with the exception of a somatic dysfunctions in the cervical spine. A somatic dysfunction is an osteopathic lesion, meaning the bones were out of line. Remember, in previous discussions, I said and I mentioned structure is function. Without proper structure, there is no function, rather dysfunction. I treated their somatic dysfunctions with osteopathic manipulation. The patient felt relief immediately after treatment. The boxer left my office and went directly to the diagnostic center for a stat MRI. An hour later, I received a fax from the diagnostic center. The MRI was normal. No brain pathology noted. What a relief. I called the boxer and informed them of their results. The patient said their symptoms had improved after receiving osteopathic manipulation. After a thorough physical exam, I was able to medically clear the boxer so they could return to the boxing gym with instructions to start slow and go slow. Start slow, go slow. Very important. I wanted the boxer to gradually work themselves back into training. I said, let's hold off from sparring, just get back into training, exercising, getting slowly into your routine, and then we can work ourselves into sparring again. This boxer is lucky. The take-home point, before joining a gym, make sure it's a certified gym. Joining a certified gym reduces the risk for serious life-threatening injuries. Again, in previous discussion, especially the traumatic brain injury, and to reduce the risk, we want to reduce risky behavior. So reducing risky choices, risky behavior, join a gym that is certified. Now on to today's topic, screening tests. The word screening in medicine refers to tests and exams used to find a disease or a medical condition in people who do not have symptoms. The goal of screening tests is to find pathology in its early phase before it causes symptoms. What's my catchphrase? If you wait, it's too late. This is why it's so important to set up a physical. We need a physical, a history and physical. I keep saying this, how important it is. Give my office a call. We can start up and set up a history and physical, routine blood work, so we can screen out for any disease or pathology. The key is to catch it in the early phases. I offer very affordable concierge practice at the price less than the cost of a monthly cell phone bill, which allows you access to quality care you really deserve. With no rushed office visits, both you and I can discuss your health care needs. To learn more about my practice, go to drtommyo.com. That's drtommyo.com. Or give me a call at 631-980-8200. Now let's cover healthcare maintenance. Now, as I stated, I'm a board-certified family physician. I did my residency at St. Barnabas, and the government and insurance companies would always come up with new terminology, basically to entice physicians to enter the primary care field. Primary care is a family physician, a general internist, a pediatrician, and an OB-GYN, specifically the GYN aspect of that. And every few years, when they notice that the field is getting lean, they come up with a new term. And while I was, actually after I graduated residency, the term was healthcare maintenance. Then you have the healthcare maintenance organization, which started in 1982, and that's what we call HMO, and that's the abbreviation. So healthcare maintenance. Healthcare maintenance is a guiding principle in healthcare that emphasizes health promotions and disease prevention rather than the management of symptoms and illness. We're taking a proactive approach, setting up a history and physical, listening, listen, and feel the patient. Very important. A lot of patients complain about when they go to the doctor's not listening to them. Their backs are turned or their heads are down while they're typing away into the keyboard. All they want to do is push medication, or the office visit's only 5 minutes. With me, I'm attentive. I'm looking at you, listening and feeling you, right? Both emotionally and physically. I'm not interrupting what you have to say. I'm listening to you. I want to know as much as possible, because this is when we develop a true patient-physician relationship. For me, a history and physical is 1 hour. 1 hour, 60 minutes. It's not 5 minutes. A lot of patients say, well, they come in, they sit in the waiting room for an hour, sometimes up to 2 hours. They come in, the ancillary staff comes in, they do what they need to do, and then the doctor comes in, and it's less than 5 minutes. Not in my office. This is your time slot. You come in at this time, and I'm spending an hour with you. I spend the time with you. And then my system will come in, we'll draw blood work, and I will be in the room with them assisting. So if you're in need of a new relationship, you're not happy with your current relationship with your physician, you feel that they're not listening to you, and this is very common. Or right now, to get into an office visit, it takes up to 6 weeks, and you end up going to an urgent care center. I discussed what an urgent care center when we spoke about 2 weeks ago the role of a family physician. An urgent care center is only for urgent visits. It's not designed for continuity of care. So it takes you 6 weeks to get into your primary care. Well, you were sick today. I can't wait 6 weeks. So what do? You end up going to an urgent care center. Well, now your copay is $90, and it could be higher depending on your plan. If you don't have insurance, it's going to be $150. They're going to bang you for $150. And if you need tests, it's going to be more than that. You need blood work, you need a UA, a urine analysis. The bill goes back up. Why? Their job is to upsell you because it is a business. In my office, there's no upsell. I'm here for you. I'm here to care for you. There is not a 6-week wait. You're not, for a new patient, the average office visit to get in could be 4 to 6 months before you establish a relationship. For me, you make that call, I'm going to get you in, I'm going to take care of you. It's going to be an hour for a history and physical. It's a thorough exam, no shortcuts. I always say, if you want the quick exam, you see the doctor across the street. You want the correct exam, you see Dr. O'Brien. So, I offer very affordable concierge practice at the price of less than a monthly cell phone bill. Give us a call. I'm here for you. Welcome back to the Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. Today's topic, screening tests. So let's continue. Before I can, go into the healthcare maintenance, so I want to continue. We started with that, but let's go over something very important. I discussed something more that you can relate to. I was discussing a boxer and traumatic brain injury, but this applies to more than just boxing. It's getting warm out. The summer's fast approaching. It's spring, especially now. We still have the salt and sand from the sanders out there, making sure our roads are safe. However, we need the heavy rains and people to broom their driveways and their sidewalks. So that's an added risk. And what do we say to prevent traumatic brain injury? We want to reduce the risk, especially the risk of risky behavior or taking on risky activities. So when you're going out there, like bike riding, make sure you're wearing your helmet, okay? Or if you're motorcycle, right? It's a little soon. It's a little early. I know, I rode a motorcycle. I enjoy getting out there, and especially when I was in Iowa, we had a no helmet law. So yeah, I took the risk. I was Evel Knievel. I rode without helmets because it feels nice to have that wind in your hair and just feeling the breeze, and it's just you, the road, and the environment. But, we're in New York. The roadways are not the smoothest. We got potholes the size of Volkswagens. We have a lot of salt and sand still on the road. So you have to be safe, be smart. Take it easy. I would, think about waiting a little bit longer until all the sand is pushed off the road and swept up. Bike riding, make sure the children are wearing their helmets. My job is to educate you and to take a proactive approach. This is about prevention, and proactive approach, preventing, just like we said, with your car. What do? We bring your car in every 3,000 miles for an oil change. It's prevention, being proactive. Well, take that same approach with your health. You're not feeling well, you're going to come in. But before that, come on in, history and physical. We want to prevent and catch disease or pathology, medical conditions before they show signs and symptoms. I have history. I started medical school 32 years ago, and I've treated, just the community members, my military brothers. I was the commander of all in New York City. I was a captain in the Army. So I took care of the troops, their family members, also amateurs, Olympians, as well as professional athletes. And I take a proactive, preventative approach. So that's my This is what I'm telling you. Let's take a proactive approach. Give me a call. Let me help you lead a happier and healthier life. So back on to healthcare maintenance. And this is what I'm talking about, being proactive. Healthcare maintenance is a guiding principles in the healthcare that emphasizes health promotions and disease prevention rather than management of symptoms and illness. What does that mean? We're being proactive. We're not waiting, being reactive. Proactive. Medicine today is reactive. My practice, I want my patients to be proactive. Come in, thorough history and physical. We get a good baseline knowledge of your health. It includes a full array of counseling, screening, and other preventative services designed to minimize the risks of premature sickness and death and to assure optimal physical, mental, and emotional health throughout the life cycle. Like I said in my introduction, history and physical, that is the starting point of the patient's story. This is when you and I develop a true physician-patient relationship. This is lacking in most practices today. Do you know your patient? Do you know your physician? Do you know your physician's name? Does your physician know your name? Does your physician know your history? If you call your office, does your doctor, your physician know what's going on? In my office, I know my patients. The other day, I medically cleared an individual for surgery. They passed. I medically cleared them. Monday, they had surgery. Tuesday night, I waited Tuesday night. I gave my patient a phone call, follow up to see how the surgery was. That guy couldn't believe that I called him. All right. And the patient, I said, yes. I said, I'm here. I want to make sure you did well. Everything's good. You're comfortable. If you need anything, I'm here for you. Before I can start screening for disease or medical condition, I must perform a thorough history and physical. Like I said, important. By knowing one's history and specifically one's family history, I can determine how to implement a healthcare maintenance program. Meaning, do I take a conservative or do I take an aggressive approach? Let's say you have your past medical history, you have a clean slate, and your family history is clean. Now, with healthcare maintenance, we have what's called certain benchmarks based on age. The medical societies, the CDC, they all sat down and we had a round table and discussed based on age where the symptoms for disease and pathology begin, and that's why we have certain benchmarks. For an example, for a male, we start PSA because we're concerned about prostate. We start screening for prostate cancer at the age of 50. But if I know there's a strong family history, the father, the grandfather, the uncles have prostate cancer, and the individual's starting to show signs and symptoms, and they're only 35, well, we're going to do a workup. I'm not going to wait for the healthcare maintenance recommendations. I'm going to be a lot more aggressive than someone who comes in who has clean slate, no history of prostate issues, no complaints, and no family history. I will wait for the healthcare maintenance recommendation. Here's another example. For a female patient who has no family history of breast cancer, a history of normal manual breast exam, that's a self-breast exam. I encourage my female patients every month to have a self-breast exam. Who, what, where, when, why, and how. Who, you, when, every month. Pick the first, second day of the month. Well, if you're not having your period, your menses ended, your postmenopausal, I would say the first, second day. Now, if you're still having your menses, you're going to wait till your menses is over when your breast tissue are back to the normal size, because during your menses, the tissue gets engorged because that's how the hormones work and that's the function of the hormones. And you would perform a self-breast exam. When, I just explained that. Where, I always tell them, go into a shower, you shampoo your hair and you throw the conditioner in. And you have to leave the conditioner in for at least 10 minutes so it can do what it needs to do. If you just put it in and rinse it out, you just wasted money because your money just went down the drain. So do a self-breast exam. I like to do what's called a circular spoke method. I know the students today, they're training different. I don't know what they're being taught, but a circular spoke method is what I was taught. And it's like the face of a clock, and you go down and, there's certain landmarks you must reach. I was asked a question because I perform breast exams with a chaperone in the room, and I educate and teach my patient on how to properly perform a self-breast exam. Yes, males have to do this as well because it's rare, but males can develop a breast cancer. But during these, I'm performing a manual exam. I teach my patients how to perform a self-breast exam. I had a patient ask me, do I have to do this on both breasts? Yes, you do. It's two separate organs. So you must perform a self-breast exam on both breasts. And there's different techniques. I particularly use the circular spoke method. Very important to do this because you're being proactive and you're going to find a mass or some tissue change way before. Because if I do a history physical today and I do a manual breast exam, I'm not going to see you for another year. So if you do perform this test every month on yourself, you're going to notice changes well before I will. And then once you notice a change, you come in and see me, and we'll take it and I'll take it from there, and we'll decide how aggressive we need to be. All right. So again, this was healthcare maintenance, and this is the guiding principle in healthcare that emphasizes health promotion and disease prevention. So you need a physician who's proactive, who's here to educate you. I'm the doc for you, Dr. Tommy O. That's right, Dr. Tommy O. I offer a very affordable concierge practice at the price of less than the cost of a monthly cell phone bill, which allows you to access the quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. To learn more about my practice, go to drtommyo.com. That's drtommyo.com, or give me a call, 631-980-8200.
The content heard on the Ask Dr. Tommy O show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.